With so many resources going into healthcare, many Americans believe that we receive the best care in the world. Americans do have great access to specialty care, surgical care, and technological innovation. That is, assuming you can pay.
When the World Health Organization talks about best, they're talking about access and cost. When a lot of other policymakers in this country talk about best, they're actually talking about technology and access, but without specifically mentioning it for those who actually have insurance.
Let's look at some general measurements of healthcare performance. The life expectancy of our nation's population is less than that of most of our industrialized competitors. Our Canadian neighbors, for instance, live 2 years longer than we do.
It also turns out that we have a higher infant mortality rate when compared with the average of 30 other industrialized nations.
So according to the World Health Organization, the U.S. ranks 31st for life expectancy, 29th for infant mortality, and our healthcare system ranks 37th overall, just behind Costa Rica and above Slovenia.
The Commonwealth Fund has done very extensive comparative work using indicators that are more directly related to the healthcare system. So, for example, they have a measure of mortality amenable to healthcare.
We can look at how many deaths could potentially have been averted by a high-quality health system. Deaths due to things like diabetes, heart disease, stroke, and infection. Here we can see that the U.S. healthcare does not perform as well as other major European systems.
A 2003 study from the New England Journal of Medicine found that Americans receive recommended care only about 55% of the time. We're far more likely to not receive recommended care for problems such as hip fracture or atrial fibrillation, a type of abnormal heart rhythm. For these problems, compliance with recommended standards is less than 25%. It's well known that foreigners travel to America for treatment in our hospitals, so-called medical tourism. And many advocates of our healthcare system point to that as evidence of quality. In fact, there are far more Americans going abroad in search of medical care than there are foreigners who come here in search of treatment. An estimated 750,000 Americans travel each year to countries such as Mexico, Thailand, and South Africa in search of low-cost treatments and surgeries.
If you talk about best from the standpoint of outcomes and economics, then we're clearly not the best. The United States spends more money than any other country on health care, yet our outcomes are either equal or worse, not better.
The question we have to ask ourselves is whether our high levels of spending is truly buying us better health.